Now, risk factors. We do know who are the patients who are more likely to develop nausea and vomiting. And these risk factors have been well studied. I classify them under patient, anesthesia, and surgery. There are many of them, and sometimes it's tough to remember all the risk factors. So over the years, there have been some attempt to trying to identify what are the most important risk factors. And some of these scoring systems, as this one by Christian Natfel, basically saying that of all the risk factors, and they are important, but if you can remember just 4 important ones. Being female, you have 3 times the risk for developing nausea and vomiting compared to men. History of PONV, or motion sickness, a very predictive risk factor. If someone tells you that, doctor, and every single time I have an anesthetic, I throw up. And those are the patients, if you don't do anything about it, guess what? It's very likely you're going to see the patient throw up again. Now, but if you develop a strategy and say, okay, I'm going to do my best, and I won't promise, but I'll do my best to make sure that you don't throw up again following this surgery, and if you do appropriate management, and if the patient have good outcome, they always thank you and said, can you give me the recipe? Because I'm going to take it with me in case I have surgery again, I can pass on this recipe to my next anesthesia care provider. Non-smoker, interestingly, is a risk factor. Not that I would advise my patient to start smoking. And interestingly, short-term smoking does not reduce the risk. You've got to be a long-term smoker. We know opioid use is a significant risk factor. Now, if you remember these 4 risk factors, the more risk factors the patient has, the higher the incidence, up to 80% if you have all 4 of these risk factors. So there's something we can do about.